The Concussion Mild Traumatic Brain Injury Knowledge Translation Task Force wanted to take some time to showcase the summary recommendation sheets for the Concussion Mild Traumatic Brain Injury Clinical Practice Guideline. These summary recommendations were created to streamline the evidence into grades of recommendation so clinicians can prioritize appropriately during evaluation and treatment sessions. These sheets are split up into screening and diagnosis, examination, and intervention. Subcategories are provided within each broad topic to help guide the user to the information needed based on what inquiry they have. The colors indicate the strength of evidence as seen at the top of each of the sheets. The legend at the bottom of each of the pages using shapes also indicate strength of evidence if you don't have a color printer. The key takeaways for the screening and diagnosis sheets are: screen what could be related to a concussive event, screen for red flags, ask appropriate questions to get in-depth subjective, make sure to create a differential list based on your screening, respond appropriately to findings, which could lead to referrals to other healthcare providers. The key takeaways for the examination sheets are: document the need for physical therapy, consider level of irritability, prioritize which systems to examine, place an impairment profile if able, consider what else influences recovery, and how are you objectively measuring the domains. The key takeaways for intervention sheets are: intervene prioritizing the highest level of evidence based on the domains you found to be involved, reassess and progress based on objective findings, and educate about the positive prognosis for recovery and the importance of rest as needed as they pace themselves as they return to their activities. You can find these resources at neuropt.org under the Practice Resources tab, ANPT Clinical Practice Guideline, and select Concussion and Mild Traumatic Brain Injury Clinical Practice Guideline.